going to call Lord of the Rings teeth. I'm going to discuss dental hygiene, and I'm going to show you how taking care of your teeth will save you pain and suffering. It will make you more attractive. It will save you money and help you live longer. Now, I work as a dental assistant for Dr. Chad Heath in Warrensburg, and I see lots of teeth. I see lots of good teeth and I see lots of bad teeth. Fortunately, I do not see Lord of the Rings teeth very often, but I have seen it here in Missouri. The thing that breaks my heart the most, though, is to see young people with rotted out teeth when it is completely preventable. I am going to explain today what happens when the teeth are neglected. I'm going to propose a solution to the problem, and I'm going to show you how it impacts your life. First, a little quick science lesson. You know how you feel when you wake up first thing in the morning and your teeth are all coated and nasty? That is because of bacteria. Bacteria is a natural, normal part of your mouth, but it forms a sticky film called plaque. Plaque is completely removable. You can brush it off, you can floss it off, but if you leave it alone, and then it will harden and turn into calculus. This cannot be brushed off. This cannot be flossed off. The only thing it can be removed by is a dentist or dental hygienist with their little tools and their scrapey things. So there's a little motivation to get rid of the plaque first. If you leave calculus long enough, you have gingivitis, which is inflammation of the gums. Hurty, painful, bleeding gums. Not good. If you leave that alone, you get periodontitis, which is full-blown gum disease, serious infection that weakens and deteriorates the bone, and you get tooth loss. Good oral hygiene will prevent all of this. The British, brushing, however, is not enough. The man on the right brushed his teeth every day. He did not floss. He did not see a dentist. That calculus that hardened on his teeth was not able to be removed by brushing alone. The British Dental Health Foundation says that bad teeth, 85% of us agree that bad teeth will affect us with our dealings with the opposite sex. It also makes us seem less intelligent, and it will hurt our chances in our career success. The American Dental Association says that 75% of Americans have some form of gum disease. And it gets worse. 164 million hours of work is lost every year due to oral health problems. Just in the last 10 years, here in Missouri, over 5,000 hospitalizations were due to preventable dental conditions. And we're finding that mouth problems do not stay just in the mouth. Untreated dental disease leaves you at higher risk for serious, terrible things like heart attacks, strokes, preterm babies, pneumonia, and diabetes. That's because infections in the mouth get into your bloodstream and travel throughout the body. So brushing and flossing is about more than just avoiding bad breath. It could shorten your life if you do not do that. Brushing and flossing seem like such a simple thing, but the American Dental Association says that we are not doing enough of it. My informal study of the class and Eric's other classes show that 55% of us brush twice a day, but only 26% of us floss once per week or more, and a quarter of us never floss at all. So we are setting ourselves up as a group here to have some serious mouth problems in the future, and possibly even diseases that could shorten our lives. So let's prevent dental disease. You can do that by brushing teeth twice a day. When you do that, get up by the gums. That's where the bacteria are sitting. Even if it's tender, get up close to those gums. Brush in circles. It's better than going side to side or up and down. Get behind the teeth. The place I see that's missed the most is right down behind those bottom front teeth. And brush your tongue, where a lot of bacteria sits. Floss every night. At night is the best time. When you floss, don't just go down like this. You want to scrape this tooth, you want to scrape this tooth, and you want to get down by the gum line. You have many different surfaces of your teeth, and you've got to clean all of them. Don't be afraid if you get a little bleeding when you floss. If you have not been flossing regularly, your gums will bleed, and you'll think something terrible is wrong. Keep doing it. It's like going barefoot. Your feet will toughen up over the summer. Same thing with your gums, so keep at it. See a dentist at least once a year. He not only can remove that calculus that builds up and causes problems, but he can x-ray and find any bone loss or infection that may not be obvious at first. And he can catch any problems that may be small before they get too big. He can also tell you where you're missing, what you need to be doing better to take care of your teeth. This one is going to be controversial. Lay off the sodas and the sports drinks. The American Dental Hygienists Association says that people who drink 3 or more sodas a day have 62% more decay, fillings, and tooth loss than the rest of us, not due to the sugar, but to the acid that is in those drinks. Dr. Heath, the doctor I work for, calls it liquid chainsaw on your teeth. So I know what you're thinking. I don't have time to brush and floss my teeth. Well, do you have time to check your Facebook or your email before bed? You probably have time to brush and floss too. Would you take a shower and only wash half of your body to save time? No, but that's what you do when you brush and don't floss. You are only cleaning half of your teeth. I always forget to brush and floss your teeth. Set your stuff out on your counter, set an alarm, do something. 21 days to make a habit, you can do that. I don't have time to see a dentist. Well, one of my previous slides showed that there are hours of time lost due to hospitalizations, illnesses, toothaches, that sort of thing. 1 hour a year to see a dentist is probably a pretty good investment. I don't have insurance, and seeing a dentist is expensive. I will agree with you on this one. The average cost of a dentist visit is $100. However, that's without insurance. But having a cavity filled, average is $225. Having a tooth pulled is about $250. A root canal, around $700. And if you lose your teeth because you haven't been seeing the dentist, you're looking at between $600 and $4,000 for dentures. So, kind of have to weigh the importance on that. I'm young and my teeth don't hurt. I'll wait to take care of my teeth when I'm older. Well, if you are not taking advantage of the recommendations that I'm making today, then your teeth are decaying as we are sitting here right now. Let me tell you a story about a man who did not take care of his teeth. He was a heavy smoker, heavy soda drinker, didn't brush, didn't floss. This is the way his mouth ended up, but let me tell you his current situation. He is in constant pain. He has trouble eating. He cannot eat the things he likes. He is forced to eat soft foods. He has bad breath no matter what he does. His speech is affected. He cannot pronounce things correctly because you need teeth for certain letters. He has chose to have all his teeth pulled and have dentures added. However, the dentures are not an easy solution either. They're rubbing his gums and causing sores. The doctor says he has diabetes and hardening of the arteries, which very well could have been caused by all the infections in his mouth. Contrast that with a woman, okay, this is not her real mouth, but an 80-year-old woman came into my office last week, and I thought to myself, 81 years old, she's going to have lots of tooth loss. Had every one of her teeth still. She had a few cavities, but she had clean, beautiful teeth. She looks good, she feels good, she does not have to worry about the things that that other guy has to worry about. She is a productive, happy 81-year-old and in excellent health. I told her, you are my new hero. Now, I realize I may not be able to convince you to take all the recommendations that I am espousing today, but if you can improve your dental health even a little bit, brush a little more often, floss a little more often, go see a dentist, then you will be rewarded for that. Unlike skin that renews itself and heals, teeth do not grow back. We only have one set, and if you want to have a smile still all your life, if you want to be able to eat steak and the things you like for as long as you live, you need to take care of them. Remember the sign that I once saw in a dentist's office. You don't need to brush all your teeth, only the ones you want to keep. Today I'm going to help you out by that. I'm going to hand you out some floss. Today is going to be the beginning for you of a future where your teeth and gums are healthy and painless.